Inclusive health is a journey. We can all take action to remove barriers and improve access to health services for people with intellectual disabilities. But sometimes it's hard to know where to start. And that's why Special Olympics has developed 4 key strategies to help you. These strategies include welcoming spaces, communication, awareness and training, and sustainable and intentional inclusion. In this video, we focus on training and awareness. Training staff on barriers that people with intellectual disabilities face in accessing health services is key to ensuring inclusion and improved access to services for people with intellectual disabilities. Here are some ways you can get started. Incorporate intellectual disabilities awareness into staff training and professional development. Hire people with intellectual disabilities to provide input on and/or conduct the training. Partnering with local disability organizations is a great way to get self-advocates involved in helping with training. Include information on unconscious biases in staff training. Train staff on the common access needs of people with intellectual disabilities. Ask staff to identify existing policies and procedures that might unintentionally inhibit access for people with intellectual disabilities. To hear from experts on the ground, we traveled to the Lee Specialty Clinic in Louisville, Kentucky.
Over the last 50 years, 100 years, the life expectancy of people with ID has greatly expanded, and the medical field has just not kept pace. Now there are more adults with intellectual disabilities than children, and our adult doctors just aren't really trained to focus on that.
Special Olympics has developed a number of strategies to help healthcare providers and their staff better understand the barriers faced by people with intellectual disabilities.
I think some of the barriers that our patients face when they're trying to access care is just some stigma from the community that this person isn't approachable. Sometimes their behaviors are a problem, and so people are fearful to approach them. A lot of times our patients are seen as inappropriate, but they often surprise people, I think, in their friendliness and their ability to communicate, and then oftentimes they're very appreciative of being worked with.
You know, the Lee Clinic is different in that everyone here seems to understand that the folks that they serve, they think differently or do things differently. They know it, and they treat our guys with dignity and respect and just make them feel welcome.
To train staff on barriers and how to overcome them, incorporate intellectual disabilities awareness into staff training and professional development.
The training that people need in order to deliver good health care to people with intellectual disabilities is not very extensive. Just a few things, just a few tips, that's really all you need. Because once you make those changes, they're there forever. It's sustainable.
It's critical to consult people with intellectual disabilities when you are providing training. Partnering with local disability organizations is a great way to get self-advocates involved.
I would recommend going to visit some of the many programs in the cities that serve folks with intellectual and developmental disabilities, or even some of the schools. Volunteer for a day. Go and sit and have lunch with them. They just regular human beings.
A great example of this is when Special Olympics Kentucky partnered with the University of Louisville to provide training to medical students.
I went to the University of Louisville and taught the second-year med students how to better care for people with intellectual disabilities. Some of the main messages I had for the second-year med students was get to know us, get to know people with intellectual disabilities, get to know what we do and don't like. Tell us what you're going to do step by step. I think it taught them how to better respect us, how to include us. I think they will become better doctors.
Unconscious bias really gets in the way of providing good medical care. I've seen patients be denied organ transplants because the unconscious bias that the physicians had that the patient would not be able to comply with the post-surgical medication regimen just because they had intellectual disability. The reality is that this stuff isn't true. A lot of times, all that's needed is a little bit of extra help, a little bit of explanation, and the patient can do everything that another patient can do.
So, treating a patient with an intellectual disability is very similar to treating any patient who may also have some mild anxiety or may even have a fear of going to the dentist. So, things that any dentist can incorporate into their practice at very little cost would be things like stress balls or sensory balls. We may give them a tour of the facility. We may allow them to sit in the dental chair quietly alone for a little bit to acclimate and be more comfortable. We also have weighted blankets. A weighted blanket works with what is known as deep touch pressure. So how that works is it actually allows a patient to feel more calm by providing some weight and pressure onto the body. So at the Lee Specialty Clinic, I really encourage my staff to bring any new ideas that they may find where they thought, wow, that may really work great for our patients, so that we can collaborate together and so that we can try to make every experience for every patient that we have the most positive that it can be.
I think it's important for everyone to have this training because you're going to eventually run into someone with a disability. And if you don't have this training, you won't know what this person with a disability needs.
For more inclusive health strategies, visit www.inclusivehealthcenter.org. Everyone has the same right to health. Don't wait for someone else to make it happen. Join the inclusion revolution.